So next we're going to be talking about inhalational therapy or meter dose inhalers with Aero-Chambers, and then we'll talk about small volume nebulizers as well for treating your asthmatic patients, your patients who are in respiratory distress who may be wheezy. You can also treat your croup patients who have stridor with small volume nebulizers. So we're just going to go over all the equipment. As you can see in front of us here, we have a bunch of different size Aero-Chambers, as well as a mouthpiece and mask type Aero-Chambers. So the one that I'm currently holding is the infant Aero-Chamber. It is good for children between the age of 0 to 18 months of age, and you can notice it right there on the device itself. The yellow Aero-Chamber is good for children from the age of 1 to 5 years of age. Again, you'll notice it's a masked Aero-Chamber. This will allow us to have better coordination of breaths for the younger child. As we move on to over the age of 5, we then move on to the mouthpiece Aero-Chamber that you see here. And this is used for 5 and above into the adult range here. And again, our technique will be a little bit different with the mouthpiece Aero-Chamber than it would be with the mask Aero-Chamber, and I will review the technique for both of those. And then we have our adult masked Aero-Chamber here. And lastly, we have an Aero-Chamber that is developed specifically to go on the end of a tracheostomy tube. So this connector here would be able to fit the 15 millimeter connector on the tracheostomy tube, and we were able to deliver MDI therapy through an Aero-Chamber to a trached patient. Now, we recommend the MDI therapy is the primary go-to therapy for inhalational therapy, and it's really highly recommended that you use a spacer or Aero-Chamber every time that you're administering your MDIs to the patients. It helps them to coordinate their breathing, ensure that the medication particles are then suspended longer and breathe directly into the lung, where they're going to provide that the most therapeutic benefit for your patients. It's really important to keep in mind if you are using the Aero-Chamber with a corticosteroid or an inhaled steroid, such as Flovent or Qvar, that the patient then rinses their mouth out after administration of the inhaled steroid, and that is just to prevent proliferation of bacteria at the back of the throat. Okay. Again, when you're choosing your device, you need to keep in mind the size of your patient, how they may understand your directions, or if they don't. So that's why you'll see the mask type of Aero-Chambers used in our smaller children, and as well as the mask one could be used in some of the larger children if they're not able to coordinate with the mouthpiece Aero-Chamber. Okay. The other thing to keep in mind when administering MDI therapy is always going back to that thorough baseline assessment, doing your vitals, doing your work of breathing, accessory muscle assessment, your breath sounds, and then doing a post-assessment after administration of the medication. So what we're going to do now is we are going to demonstrate the use of the Aero-Chamber and how to prime your MDIs for use with your Aero-Chamber. Okay, so the biggest thing that you want to do, especially if this MDI is new out of the package, is to give it a shake approximately 5 to 10 times. And then in order to prime your MDI, you want to just depress it and look for a clear mist coming out of the MDI. Now, with the first spray, you generally won't see a lot of mist coming out. You may have to do it a couple times before you see your mist. This MDI is now primed and ready to deliver medication to the patient. I recommend shaking it between each puff just to allow the canister some time to recharge itself. Okay. Now, with our mannequin patient here, it might be a little bit difficult for them, obviously, to coordinate their breaths with the mouthpiece Aero-Chamber. So this is where we'll demonstrate the use of the masked Aero-Chambers with our mannequin here. So you have your order from your physician to deliver an MDI therapy. In this case here, we're going to use the Ventolin or salbutamol inhaler. Because we have a patient who cannot coordinate breathing using a mouthpiece Aerochamber, we're now selecting a masked Aerochamber. So again, we've already primed our MDI. We've shaken it a few times. We are now going to insert the MDI into the back of the Aerochamber, just like that. So again, it would be upright with the upper part of the nose part of the mask there. You're then going to come to your patient, apply it to your patient's face just like so, depress the MDI, and then what we're going to do is we're going to count 5 breaths. There is a valve right there that in your breathing patient, as they take a breath in, you'll see that valve move in and out. Count 5 to 6 breaths per puff. Once that 5th or 6th breath is done, remove the Aerochamber from your patient. Repeat your steps of shaking, again, 5 to 10 times. Reinsert it into your Aerochamber, and then we will administer the puff again to your patient, again repeating those steps of 5 to 6 breaths. Okay? And you are going to repeat those steps for every puff that is ordered or prescribed by your physician. Now, if you have a patient who is breathing too quickly or too hard as they're inhaling the medications, you are going to hear a whistling sound. So I'm going to demonstrate that for you. So placing the mask on the patient's face, instructing them to take a breath in. You want them to take a nice, slow, long, deep breath in. But I'm going to be a non-compliant patient. I'm going to take a quick breath in here. So you hear that whistling sound there. That is an indication to you that the patient has breathed in too quickly, is potentially creating turbulent flow, and will cause less deposition of the medication into their lungs for that therapeutic benefit. So the biggest thing to keep in mind when you're using the Aerochamber and you're hearing that whistling sound, it doesn't mean that you should repeat that dose for the patient. It just means that you have a moment to teach the patient to breathe slower if possible. So if you have a patient that you want to use the mouthpiece Aerochamber with, again, you pretty much go through the same steps as you did with the masked Aerochamber, shaking it, inserting it, just like that. It has a little valve here at the back that usually it's in the upright position here. So when you insert your Ventolin inhaler there, and then you can remove your mouthpiece and then instruct your patient to breathe out all the way to try to empty their lungs as much as they can, like this. And then breathe out. So what I did there was I had the patient breathe out all the way to empty their lungs. I then brought the mouthpiece up to my mouth, created a nice seal around the mouthpiece, depressed the medication, and took a nice, slow, deep breath in, filling up my lungs as much as I can, holding for 5 to 10 seconds, and then breathing out. That whole process there will be one puff, and you will repeat those steps for every puff that has been prescribed. It's really important to keep in mind that for your older children who are able to coordinate with the mouthpiece Aerochamber, to take your time, because a lot of that deep breathing will actually sometimes cause your patient to feel a bit lightheaded. So just take your time, and it allows the MDI to recharge itself, so that we're ensuring that each subsequent puff, we're getting the full medication delivered. In addition to MDI therapy is your nebulizer therapy, and everything that you would need for administering nebulized therapy could be found here. So we have oxygen tubing, we have our small volume nebulizer here. I have some corrugated tubing and a T-piece that I will talk to you a little bit about how we can build a different treatment setup if a patient will not keep a mask on here. And we have a pediatric sized aerosol mask. In addition to the equipment that we need, we have all the medication that we could potentially be nebulizing. So I have different sized vials of Ventolin and Atrovent here in these foil wrappers. I also have a nebule of budesonide here, so that's for an inhaled steroid. We have some saline in case we need to dilute our vial of Ventolin that we have right here. So again, we may have a specific dose of Ventolin that may be ordered that is not within a nebule that we have available, so then you may have to draw up your own Ventolin here. Because there's not enough volume, depending on the dosage, you will need to add some saline into that. In addition, we have a vial of epinephrine here. So again, this could be used to treat upper airway swelling or stridor associated with croup. If we needed to draw up any of the medications, you'll need an appropriately sized syringe for the dose as well as a blunt fill needle. In addition, you will need some alcohol to do the friction scrub on the top of the bottle when drawing that up. Okay, so initially when COVID first came around, nebulizer therapy was considered an aerosol generating medical procedure. That has since been removed from the consensus of what is an aerosol generating medical procedure. However, that being said, we're still treating it, our COVID suspect and COVID positive patients as potentially being able to spew virus out into the environment. So if you are nebulizing a treatment with a non-COVID suspect patient, it's very important, especially if you're in the emergency room or in a semi-private room, that you pull the curtains between the patients while administering the nebulized therapy. Okay. It is also a great way to deliver a medication to a patient who is uncooperative or unable to coordinate MDI therapy. So the nebulizer is also an important part of that. Or in the case of croup, if you had to nebulize epinephrine, it's only available in the liquid form. It doesn't come in an MDI form that is available in Canada to treat croup. So you have to draw it up in through the vial. Okay, so it can be challenging to give nebulized therapies to children because especially young children don't like anything near their face. So because of that, and because they may not be able to keep the aerosol mask on, we also have a TP setup that we can create in order to administer an MDI therapy, and we'll show you how to deliver that. What I want to do next is demonstrate just how we would draw up a medication to administer it via a nebulizer that is not in a pre-filled nebule. And we'll say we are treating a croup patient in Emerge. The doctor has asked us to draw up 5 milligrams of epinephrine to deliver via inhalation. So you would then grab your 30 ml vial of epinephrine here, and then you would pop off your lid. You would take your alcohol and you would scrub it, and then you would prep your syringe. And because we're drawing up 5 milligrams or 5 mils of epinephrine here, I have a 5 ml syringe available with a non-filtered blunt fill needle. For demonstration purposes, right now I'm just going to draw this up from a saline vial right now. So again, be careful when puncturing, and then just draw your 5 mils back out of your vial. Okay, we have approximately 5 mils there of epinephrine now. Okay, be careful with recapping. And then you would just insert your epinephrine into your nebulizer, just like so. Okay, You'll discard that in the sharps. Okay, and then we'll grab our aerosol mask, attach that to our nebulizer. We'll make sure that our connections are nicely, tightly fit. And we're gonna then attach our oxygen tubing to the bottom of the nebulizer, and then we'll come over to the flow meter and we'll attach it on the wall. We've drawn up our epinephrine. So our physician has ordered 5 milligrams of epinephrine. So the 30 ml bottle is 1 in 1,000, 1 milligram per mil. So again, 5 mils equals 5 milligrams of epinephrine. We've already put that in our nebulizer when we set up our nebulizer. So we're going to come over to the flow meter and attach our oxygen tubing to the nipple of the flow meter. And we are going to set our flow between 6 and 8 liters per minute for nebulization. So it's really important to keep in mind that 6 to 8 liters per minute. Any higher than that and you get a lot of back pressure, you will have the oxygen tubing pop off of your flow meter. And it can startle your patients as well as their caregivers at the bedside. So as I turn that up to 6 liters per minute, you'll hear the nebulizer start to make some noise, and then you will see some mist come out of the nebulizer. Position your patient in an upright as possible position as you can. You want to ensure to allow gravity to help you out here with nebulizing all that medication. And then we'll apply it to our patient, just like so. Okay, just kind of mold the mask to their face a little bit. And you'll observe your patient as the therapy is running. Okay, 10 to 15 minutes should, depending on the volume that is administered, should allow the nebulizer to empty. So we're still running our nebulized treatment here with our patient, but our patient's really non-cooperative and maybe is thrashing around, doesn't like the mask on their face. They keep on knocking it off. Well, what can you do in order to still administer this medication to the patient? Well, we can build a T-piece setup that can attach to the nebulizer without the aerosol mask, that we can deliver the medication to our patient. Okay, so what we're gonna need in order to build that at the patient is 6 inches of corrugated tubing. I'm just gonna turn that. Okay. A T-piece, okay, and a little bit of waterproof tape, just to occlude one end of the T-piece, just like so. So we'll just cover that. Okay. If you have a ventilator circuit cap laying around, that will fit nicely on there. Otherwise, waterproof tape will do the trick for us. Take your corrugated tubing and attach it to here. We'll remove the nebulizer and the aerosol mask from our patient. Attach our T-piece to the top of the nebulizer just like that. Come back over to our flow meter, turn it at 6 liters per minute. 68. And now we are able to deliver the nebulized therapy to the patient just like that, and they'll be able to breathe it in. There is a little bit more waste associated with delivering it this way. However, they are able to still breathe in the medication and get some benefit from it. So this is the T-piece setup that we can use in addition, okay? One of the other things that we want to keep in mind for children especially is the use of blow-by therapy, and that's usually using your venti piece attached to a piece of corrugated tubing and just blowing that dry oxygen at the patient because they won't keep on an aerosol mask. It's important to try to get them to either wear nasal prongs or maybe attempt to set them up on high flow. Blow-by therapy is not recommended because there's no guarantee that the patient is actually getting oxygen therapy, especially when you're walking away from the bedside. So we want to say bye-bye the blow-by. So occasionally you're going to get a request for an order of Ventolin that is smaller than what may be in one of your pre-filled nebules here. So what you're going to do is you're going to grab your 10 ml vial of Venolin. It's actually 5 milligrams per ml. Say the dose is for 1.25 milligrams. So knowing that it's 5 milligrams per ml, half a mil is 2.5, half of 2.5 is 1.25, which is now a quarter of a mil. So with your 1 mil syringe here, we're going to draw up a quarter of a mil of Venolin. So we'll take our blunt fill needle, we'll open our vial. Now the vial is open, it doesn't have a rubber stopper that you have to puncture. And then we're just going to draw up a quarter of a milliliter here, 0.25 mils, which is roughly there. Okay, we'll recap again, be careful recapping, and discard that in sharps. We're then going to come over to our nebulizer right here. We will put our 0.25 mils of Venolin in there, and then we need some saline in order to give us at least 3 mils of volume for this to work. If you have pre-filled nebules of saline, these are 3 mils. That's enough volume in order to administer the medication. So just take the 1 nebule of 3 mils of normal saline, squirt that into your nebulizer just like that. Attach your aerosol mask or your treatment gun, and then you can administer it to your patient. If you don't have the pre-filled nebules of saline, just get your sodium chloride vial here and then draw up 2.5 to 3 mils out of that.